Laboratory guidelines is sort of the current manifestation of evidence-based medicine. What's happened is we are in a transition. A transition probably has started 25 years ago, but basically we're going from essentially eminence-based medicine and going on to evidence-based medicine. And the role of the guideline is to help pathologists and clinicians synthesize through all the literature that's been published and sort of extract the essence of what someone needs to do in a situation. So when you have a patient and they have X condition, the guideline prescribes you should be doing this. That's the essence of evidence-based guidelines. Well, we've been in the business of developing evidence-based guidelines since 2010. CAP, the College of American Pathologists, has committed to doing this. And it's very important because so much of the decisions that get made clinically for patients are based on laboratory tests. So there are many situations where you have a test and we want to make sure that the test is done appropriately and also the right test is done for the right patient. So the evidence-based guideline can help guide those situations. Just this year we are completing a couple of guidelines that will be released shortly. One is regarding HER2 testing in gastric cancer. Another one is regarding molecular testing in colorectal cancer. We're also very close to releasing a guideline on testing for HPV in head and neck cancers. This is an ongoing process. So, for instance, we started out with releasing guidelines for HER2 testing in breast cancer. We did that in 2007. Actually, that was in association with ASCO. We had to revise that based on input that we've gathered from pathologists, from laboratories, and it was revised in 2013 and we released it at that point. Now we're continuing to explore, and we may have yet another revision because the guidelines have to be current and relevant to the current practice. So every one of these guidelines that we release now, we keep maintaining, looking at the literature, make sure that it's still current, it still addresses the current problems. And as situations change over time, we will address that and the guidelines will change with that. They're living documents, they're not static. We release them at one point, but they continue to change over time.